Medical assistance in dying has been available in Canada since 2016. All patients must meet very specific parameters, including suffering from a grievous and incurable medical condition.
There are bound to be a few problematic cases, a very small minority of difficult cases, and that's where the parameters and the processes get tested. But for the vast majority of cases, I think they're working perfectly well.
Most Canadians want medical assistance in dying, and I believe it's here to stay. There's no question about it. But what we're really facing now is the socially complex issues of poverty, of race, of underhousing, all these types of things that, to be honest with you, I don't think we've thought through fully. Because yes, we can say medical assistance in dying is great, let's make sure everybody's capable. But, you know, when people are doing it because they can't get help, they can't get support, they're losing housing, they can't get treatment, they can't get mental health support, that's not what this is meant to be about.
A study released from the MAiD Death Review Committee identified cases that raised some concerns that social issues like housing and mental health have been a motivating factor in the application and resulting medically assisted death.
There are going to be some challenging cases. Overall, and interestingly, if you look at sort of the socioeconomic conditions of people who access MAiD, most indicators in most jurisdictions show they tend to be relatively affluent. It's not overall poor people. And that's not surprising because people of higher socioeconomic levels usually have better access to the healthcare system, including MAiD.
The cases highlighted in this report are a small percentage of all medically assisted deaths. The committee's recommendations to Health Canada include providing additional guidance when MAiD is requested by a person with a mental health condition, and the request and suffering is predominantly psychologically oriented.
The hard cases are overall much less than 1% of total MAiD cases. It's working perfectly well in all of those other cases. We don't want to change the system in order to accommodate these hard cases. We want to find a way to deal with them on a case-by-case basis.
All jurisdictions in Canada, with the exception of Manitoba and the Yukon, have seen a steady growth in MAiD applications since 2022. In Toronto, Beverly Andrews, CityNews.